Nigeria's health sector is facing a worsening crisis as the exodus of medical professionals abroad continues to deplete the country's workforce. Key professional bodies, including the National Association of Resident Doctors, the Nigerian Medical Association, and the Association of Medical Laboratory Scientists of Nigeria, have raised fresh alarm, warning that the trend is placing unbearable pressure on the nation's healthcare system and threatening its survival. Speaking at the opening of NARD's 45th Annual General Meeting and Scientific Conference in Katsina, the association's president, Dr. Tope Osundara, revealed that the number of resident doctors had dropped from about 15,000 in 2014 to just 8,000 in 2024. He explained that poor pay, overwhelming working conditions, and a lack of manpower had driven many doctors to seek opportunities abroad. Dr. Osundara stressed that the mass exit of health workers had worsened the burden on those left behind, resulting in more critically ill patients and fewer professionals to care for them. He said the government must introduce stronger incentive policies, fairer pay structures, and improved training opportunities to rebuild confidence among health workers. He also lamented that for over a decade, there had been no meaningful attempt to enhance doctors' salaries through a collective bargaining agreement. Despite the challenges, he commended resident doctors for their resilience, noting that their commitment had enabled NARD to record progress in advancing the welfare of its members under his leadership. On its part, the Lagos State chapter of the NMA identified 4 urgent steps the government should take to halt the brain drain. The chairman, Dr. Babajide Shahid, called for upward review of the consolidated medical salary structure, better welfare packages such as housing and car loans, investment in both local and foreign training of doctors, and massive upgrades to hospital infrastructure. He stressed that good working conditions, from well-equipped call rooms and consulting spaces to functional theaters, were just as important as higher salaries in retaining health workers. Meanwhile, the MLSN described the Japa Syndrome as a national emergency. Its president, Dr. Kashmir Ifeanyi, said Nigeria was bleeding not from war but from the steady flight of its most critical workforce. He explained that tens of thousands of doctors, nurses, pharmacists, and laboratory scientists had left in the last 3 years, leaving hospitals overstretched and patients facing longer waiting times, declining quality of service, and preventable deaths. Dr. Ifeanyi insisted that health workers were not living out of disloyalty, but because conditions at home made it nearly impossible to serve with dignity. He warned that without urgent reforms, Nigeria's health system risks collapsing completely. As a way forward, he outlined steps such as fair and timely pay, safe workspaces with adequate equipment, structured career growth, accurate workforce data, ethical management of international recruitment, and diaspora engagement programs to allow Nigerian experts abroad to transfer skills and knowledge back home. Nigeria's leading health professional bodies agreed that the Japa Syndrome had become one of the gravest threats to the nation's survival, draining the country of talent and weakening its already fragile healthcare system. They called on the government to act decisively, insisting that fair pay, better welfare, and massive investment in infrastructure are urgently needed to stem the tide. Without such action, they warned, Nigeria risks pushing its healthcare system to the brink of collapse. Uche Jacinta for Eagles FM News.